everyone, welcome to Health Hacks. We are Formally and we made visually impaired friendly medical forms. I'm Vivian and this is Eugene. We're the problem owners. First of all, we would like to begin by acknowledging and paying our respects to the Agara people, the traditional custodians of the land on which we are gathered today.
We would like to pay our respects to their elders, past, present, and emerging, and acknowledge all Aboriginal and Torres Strait Islanders here today, also paying our respects to your elders, past, present, and emerging. So in terms of the problem, sorry, it's a bit blurry, might be an issue. That's better. The problem we're targeting is that current systems in healthcare, which cater for people with visual impairments, like the blurred screen we just experienced, are limited. This results in a prevailing lack of patient autonomy and ease, which discourages their attendance and compliance.
Ami developed minuscule forms. Do you understand any of this? People with certain visual impairments will interpret text similar to this. As a result, our aim is to develop medical forms for clinics and to accommodate these people, therefore increasing ease and autonomy.
So, what's the solution? Well, we would like to use a QR code or link that people can access online or at a medical practice. The code would bring patients to a website that has built-in web accessibility options that work with current vision-impaired assistance tools. This way, visual impairments ranging from farsightedness to complete blindness will all be supported. This form is then sent to the practice after the user submits it. So here are some of the options for accessibility that will be going in the demo.
So here we are scanning the QR code to bring us to the form.
And now we're going to show up the accessibility features. So we've got the dark mode as shown here. Also, we've got the reader mode, which widens the text. We've got different sizes for the text, as well as changing the font. One thing I'd like to note is there is a specific font for patients with dyslexia.
And now we'll move on to the narration section of our form.
New patient registration. Tap to use accessibility features. Section A, surname, given names, text field, given names, shift. Tap cap A, L, E, X, hide keyboard. Text field, Alex, male, checked. Page 2 of 4. Page 3 of 4. Page 4 of 4.
Hello everyone, my name is Bashar and I will be presenting the tech side of the project. We use the Ionic Angular framework for the front-end development. It's not a widely popular framework amongst developers, but it offers great tools for cross-platform mobile development. Node.js, a very popular framework, was used for the back-end side of the development. WebAIM is a non-profit organization that set the standard for web accessibility. We refer to the different levels they have provided to make our app more accessible. And now to the next slide. With the limited time we had, we were only able to complete what we showcased earlier. In the end, we want the submitted form to be sent to the clinic by email. Moving forward, we plan to use the FHIR standard, a standard targeted towards healthcare use to store and forward the user's data to their respective clinics. Finally, we would also like to thank our wonderful team and the amazing contributions they've made to this good cause. We also wish to thank the amazing sponsors whose support have made this hackathon and pitch possible. And this comes to the end of our presentation. Feel free to ask any questions. Thanks.